Hey everybody, it's Wade over at IMA. Today we'll be showing you a trauma assessment video. Hope this helps. Okay, you are dispatched to a 35-year-old male who was kicked by a horse.
All right, I'm going to take my BSI precautions, put my PPE on. Is my scene safe?
Scene is safe.
All right, so my mechanism of injury is going to be a patient who's been kicked by a horse. Is this my only patient?
This is your only patient.
Okay, at this time I'm going to request additional EMS in the form of ALS, and due to the trauma mechanism, I'm going to consider C-spine. So I'm going to tell my partner, I need you to hold manual inline stabilization and not let go until I tell you.
Okay.
So what is my general impression of my patient?
As you approach your patient, he is, as you see him, lying supine on the ground. He appears to be in a horse corral. He has his right hand over the right side of his chest. He is alert, eyes are open, and he's tracking you as you walk.
Okay, so I'm going to walk up, talk to my patient, ask him what's going on today.
He says that he got kicked by a horse about 10 minutes ago.
So my patient is alert, and I know that his chief complaint is being kicked by a horse. Do I have any apparent life threats or major bleeding at this time?
You know no major bleeding at this time, but you do see some labored breathing.
Okay. Due to my patient talking to me, I can confirm that my airway is patent. Do I have any injuries that are compromising the airway?
Not at this time.
Okay. At this time, I don't feel the need to suction or place any adjuncts. What is my breathing rate, rhythm, and quality?
He is breathing shallow, an elevated rate, at a regular cadence. You do notice irregular chest rise and fall.
Okay, due to the irregular chest rise and fall and the shallow breathing, I'm going to initiate oxygen therapy with a non-rebreather at 15 liters per minute.
Copy that.
Circulation, what is my pulse, rate, rhythm, and quality?
It is fast, regular, and with thready.
Okay, and again, no major bleeding?
No major bleeding noted.
Okay, what is my skin temperature, color, and condition?
Pale, cool, diaphoretic.
Okay, this time I'm probably going to treat my patient for shock due to him being pale, cool, diaphoretic. So I'm going to leave him in a supine position, cover him up. I do have high flow oxygen going, and the only other treatment I have is priority transport.
Copy that.
So my patient has a regular eye opening, spontaneous. Is he able to obey commands for motor response?
He is.
Okay, and his verbal response seems oriented conversation, so I'm going to give him a GCS of 15 at this time.
Copy.
I don't see any major disabilities due to his injury as well.
Copy.
So at this time, I'm going to expose my patient and remove the clothing.
Vitals is.
All right, so I've removed my patient's clothing, and I'm going to confirm that this is a priority patient. I'm going to load and go at this time. Can I get a baseline set of vital signs, including blood pressure, pulse, respiratory rate, and SpO2?
Blood pressure is 80/60. SpO2 on the non-rebreather is 94%. Pulse is 130. Respiratory rate is 32 and shallow.
Okay, at this time I'm going to attempt to obtain a sample history from my patient, asking about any allergies, medications, any past pertinent medical history, last oral intake, and events leading up to this.
He says he's allergic to strawberries. For medications, he doesn't know, as well as pertinent history, because he does not go to the doctor often. He says the last time he went was 20 years ago. Last thing that he ate was breakfast this morning at about 6 a.m. And then he was out training the horse, and the horse reared up and kicked him in the chest.
Okay. Due to my vital signs, I still believe that my patient might be experiencing some shock. So after I exposed, I would make sure to recover him to conserve that body heat.
Okay.
This time we're in the back of the ambulance, headed to the hospital, lights and sirens with our priority patient. I'm going to go into my secondary head-to-toe assessment.
Okay.
So I'm going to start at the head, work my way down. I'm going to be checking for DCAP BTLS, which is deformities, contusions, abrasions, punctures or penetrations, burns or bruising, tenderness, lacerations, and swelling. Do I notice any of that to the head or scalp?
Negative.
Do I notice any fluid coming from the ears?
Negative.
Okay, I'm going to use my pen light and check the pupils. How do my eyes look?
Pearl.
Okay. And do I notice any injuries to the face or the mouth or jaw?
Negative.
Okay. So I'm going to move to my neck. I still have my partner holding C-spine, so I'm going to palpate my cervical spine. Do I have any step-offs or deformities?
Negative.
Okay, so since I don't have any, I'm going to also check for tracheal deviation. Is my trachea midline?
It is midline.
Okay, and do I notice any jugular vein distension?
Negative.
Okay, so since I'm done with assessing the neck, I'm going to have my partner apply an appropriately sized C-collar. And I'm going to continue moving down towards the chest. So I'm going to check the shoulders and clavicles, assess the integrity of the sternum, and I see that I have some bruising over here on the patient's right side. Do I have any paradoxical movement with that might indicate a flail chest
You
segment?
do note paradoxical movement to the right side of the chest with significant bruising. You also note that during inspiration, one side of the chest is not moving. More specific, the right side of the chest is not rising.
Okay, so I have some unequal chest rise and fall. I've inspected and palpated the chest. Now I'm going to listen to lung sounds, alternating sides. What are my findings?
Left side is clear, right side is absent.
Okay, so right side absent. So I believe that I have a pneumothorax due to that trauma and flail segment on that right side. I'm going to note that, continue my high flow oxygen, and make sure to pass that on once I arrive at the hospital.
Perfect.
I'm going to move into the abdomen, assessing all 4 quadrants, rolling. I'm checking to see if it's soft and non-tender, checking for temperature, firmness, and reaction from my patient. Do I have any abnormal findings in the abdomen?
Negative.
Okay. Next, I'm going to move into the pelvis. I'm going to assess the integrity of the pelvis. Is it stable?
It is stable.
Okay. At this time, I don't feel the need to check the genitalia.
Copy that.
So I'm going to move into my lower extremities, starting with the patient's left leg, checking the integrity of the femur, as well as the lower leg, and checking pulse motor sensation in the foot.
It is intact.
Intact. And then I'm going to repeat the same on the next side. Again, checking for pulse, motor, and sensation.
Intact.
Intact. So I'm going to move to my upper extremities, starting with the left arm, and checking for the integrity and feeling for pulse, motor, and sensation.
Intact.
Okay. And then doing the same on the other side, again, checking for pulse, motor, and sensation.
It is intact.
Okay. So I've checked everything on the anterior side. I still need to check the posterior thoracic, lumbar, and buttocks area. So I'm going to log roll my patient on his left side to avoid rolling on that injured side.
Copy that.
So with my partner's help, I'm going to log roll my patient towards me, and I'm going to palpate the thoracic, lumbar, and upper buttocks area, checking for any step-offs or deformities in the spine.
No abnormalities noted.
Okay. So I will replace him to a supine position. And so far, the only injury that I have is my flail segment on the right side, as well as what I believe to be a pneumothorax on that right side due to that injury.
Okay.
So I'm going to continue to assess that, making sure that it isn't moving towards my patient's left side. I'm going to continue my rapid transport to the hospital and continue my reassessment every 3 to 5 minutes. And I don't see any other secondary injuries to manage this time.
What would you like to obtain on your reassessment?
I would reobtain a full second set of vital signs or a new set of vital signs every reassessment, including blood pressure, pulse, respiratory rate, and SpO2,
Okay.
as well as my overall patient condition.
Okay. Your new set of vitals is as follows. Your blood pressure is now 70/50, pulse is 135, SpO2 is maintaining 94 on high flow, respiratory rate is maintaining 32 and shallow.
Okay, so my vital signs have decreased a little bit, so I believe my patient is moving more towards decompensated shock, so I'm going to continue my rapid transport.
Copy that. So that was a trauma assessment video. Hopefully that helped you guys out. Like always, guys, feel free to like and subscribe our videos. We'll see you next time.